Question period. I recognize the Leader of the Opposition.
Mr. Speaker, can the Premier update this Assembly? How many hospitals are on critical care bypass and turning patients away?
Recognize the Premier.
Number, Mr. Speaker, with me, but I can assure you it's less than it was under the New Democrats. Mr. Speaker, we have had a concerted effort over 16 years now, Mr. Speaker, 16 years of investment in health care, Mr. Speaker, not only in facilities. We were up at the urgent care centre here in Regina just the other day, Mr. Speaker, 85% complete facility, a new and innovative way to deliver not only urgent care in our community and for surrounding communities, Mr. Speaker, but to also be an intake, a centralized intake for mental health and addictions challenges that we have in our communities, Mr. Speaker. You've seen hospital after hospital being built, most currently, Mr. Speaker, work being done on Weyburn, Yorkton, and at the Prince Albert Victoria Hospital, added 5,000 nurses to those facilities, offering services to Saskatchewan residents, over 1,000 physicians, Mr. Speaker. And while we have the members from RJC here, I failed to mention a new hospital coming in Rostron.
Recognize the Leader of the Opposition.
Mr. Speaker, with all the self-congratulations, I think it will come as a surprise to this tired and out-of-touch government that they're failing to deliver on health care. A leaked SHA document, Mr. Speaker, makes that crystal clear. Right. From a memo, and this was sent yesterday, about critical care in Saskatchewan, I quote, North Battleford, start bypass. Saskatoon, continue bypass. Yorkton, continue bypass. Moose Jaw, continue bypass. Mr. Speaker, how is it acceptable to this Premier for 4 different hospitals in this province to be on critical care bypass because of his mismanagement of our health care system?
Recognize the Premier.
We heard earlier this week and last week, Mr. Speaker, some of the initiatives that we heard from the Saskatchewan Health Authority, some of the initiatives that they are taking to ensure that we have the resources available in our emergency rooms, Mr. Speaker, this fall as we find our way through flu season and other reasons that people are utilizing our hospitals. I spoke in an earlier answer about the capital investment and the ongoing, at a high level, Mr. Speaker, over the last decade and a half, the investment that has resulted in more nurses and more physicians working in our facilities. We need more than that, Mr. Speaker. Like all other provinces across Canada, the health human resource challenge that we have in Saskatchewan is not only in Saskatchewan. It's not exclusive to our province. I talk with other premiers on a weekly basis, Mr. Speaker, and all of the provinces and the 3 territories in our nation are working hard, and I would say working collaboratively on how we can train more medical health professionals in our provinces to contribute not only to a stronger provincial health care system, Mr. Speaker, but a stronger national health care system. We have in this province one of the most ambitious health human resource plans in the nation of Canada, Mr. Speaker. It's one that we discuss at those national tables often, Mr. Speaker, and it's one that the Minister of Health mentioned earlier this week is really starting to show results in our communities. We need more results, admittedly, into the next number of months, with 870 new nursing grads that have been hired into the Saskatchewan Health Authority, Mr. Speaker. They'll be offering services in a Saskatchewan community, plus over 400 folks from the Philippines, Mr. Speaker, medical health professionals that are coming to Canada as well.
Recognize the Leader of the Opposition.
Mr. Speaker, this Premier's mismanagement of our health care system, it extends down here to Regina as well. Right. Another internal memo, SHA document, this time an email, and it says this, I quote, Mr. Speaker, Regina's emergency departments are facing immediate capacity challenges and risk safe patient care. This is contributing to significant EMS offload delays, presenting a risk to those in the community as available EMS crews are reduced. I end the quote, Mr. Speaker. Why does this tired and out-of-touch government think that it's acceptable in any way to risk safe patient care because of this Premier's mismanagement of the health care system?
Recognize the Premier.
this is not acceptable. This is why you're seeing investment in EMS services, not just in Regina, but across the province, Mr. Speaker, again, which were discussed a day or two ago on the floor of this Assembly. This is why you're seeing investments in our emergency care human resourcing efforts, which was announced by the Saskatchewan Health Authority just last week. This is why you're seeing investments like the Urgent Care Centre on North Albert Street here in Regina, pardon me, Mr. Speaker, but another one partnership with Attackakuk Cree Nation, Mr. Speaker, delivering services, urgent care services, non-life-threatening but urgent care services, relieving some of the pressures that we are seeing in our emergency rooms in our largest centres, Mr. Speaker. Aside from that, having an intake, a centralized intake for those that may be having a mental health crisis, Mr. Speaker, may have entered a life of addictions, unfortunately, Mr. Speaker, and are ready to make a change. These are new and innovative ways to deliver health care in our communities, Mr. Speaker, and these are new investments, continued new investments that are coming from the government of Saskatchewan.
Recognize the Leader of the Opposition.
Speaker, this is hardly a time for self-congratulations from that government. This is after 16 years, this is their record. Right. And nowhere is this tired and out-of-touch government's failure in health care more clear than when it comes to the mammogram policy announced yesterday. 10,000 fewer mammograms this year because of this government's utter mismanagement and chronic short-staffing. And now, Mr. Speaker, we're sending women to Calgary for a simple scan and procedures that they should be able to get here at home. Mr. Speaker, it is absolutely unacceptable. Will the Premier show some contrition and apologize to the women of Saskatchewan who are paying the price for this government's mismanagement?
Recognize the Minister of Health.
Thank you, Mr. Speaker. As I'd indicated before, these are unacceptable wait times for Saskatchewan women. And this is why, in addition to the longer-term solution to hire the necessary specialized radiologists to provide these services here in Regina, here in southern Saskatchewan, closer to home, we're also taking immediate and urgent action to address the wait list, which is why, Mr. Speaker, yesterday and very quickly in recent days, our officials were able to work with a private divider, publicly funded in Calgary, to offer up to 1,000 different procedures, diagnostic mammograms, ultrasound imaging, and breast biopsy, to give Saskatchewan women this option to be able to access the care that they need as quickly as possible, Mr. Speaker. And Mr. Speaker, I would say this: one of the women who I met with, as the Minister, Mr. Speaker, Jody Krajewski, had said yesterday, the government's urgent action to ensure timely diagnosis for patients is welcome news to Saskatchewan women. Thank you, Mr. Speaker.
Hear, hear.
Recognize the Leader of the Opposition.
Here's a news flash for that minister and that premier. This is not a good news story. It's an indictment of that government's record when it comes to women's health in this province. Mr. Speaker, they have let short staffing become the norm. 10,000 fewer scans this year than last year. And this government, so focused on their own pet projects, that they have let it come to this point, Mr. Speaker. Instead of focusing on Dubai, the Premier should be focused on ensuring that women in this province can get the care they need where they need it. Again, will the Premier or that minister apologize to the women of this province?
Recognize the Minister of Health.
Thank you, Mr. Speaker. This government will not apologize for the actions that we have taken yesterday and the future actions that we will take, the investments we have made into health care, Mr. Speaker, significant investments into this area, Mr. Speaker. You know what? We're not going to apologize for the investment yesterday. We're not going to apologize for any of the investments that we have made into health care, from meeting with Saskatchewan women to meeting with health care providers to look at all options to address these waiting lists, Mr. Speaker. I'll tell you what, Mr. Speaker, the Leader of the Opposition, she's had plenty of opportunity here to outline her plan. As recently as yesterday, Mr. Speaker, she was asked by the media in Saskatoon, are there any immediate or definitive actions you could start to take to alleviate this problem? And what did the Leader of the Opposition say, Mr. Speaker? Well, she kind of hummed and hawed a bit and said things like, well, one of the things that we have heard from healthcare workers is they have ideas, they have solutions. You know, there's a lot of people leaving the healthcare system, they can't find a job. But there's been no plan from that Leader of the Opposition. Plan to fail to plan NDP across the way.
Recognize the member from Regina Alfred Stone Centre.
16 years, Mr. Speaker, and now a 16-hour drive. It's so disappointing. Mr. Speaker, this tired and out-of-touch government is failing to deliver for Saskatchewan women, and they're failing when it comes to basic accountability and transparency. The Ministry of Social Services, the minister has said that $172,000 was spent on the Sunrise Motel just last year. $172,000 paid out to his colleague, the member for Regina Northeast. But the Public Accounts Volume 2 report for that year shows none of that, Mr. Speaker. No payments to the Sunrise Motel, no payments to Rural Hospitality Inc. To the minister, why not?
Recognize the Minister of Social Services.
Mr. Speaker, in terms of information gathering, the ministry is working very hard to get the information noted from the member opposite, and that work is underway. Mr. Speaker, the provincial auditor, as I mentioned the other week, will look into the procedure around securing hotels in her annual audits, and that's my understanding from. That is my understanding from officials that have let me know that. So, Mr. Speaker, again, our priority is to ensure everyone has safe access to shelter and a warm, safe place. That's the side we're going to err on, Mr. Speaker, in dealing with hotels in emergency situations.
Here. Recognize a member from Regina Elphinstone Centre.
Mr. Speaker, it's been more than 2 weeks that we've been asking these questions, and nothing from this minister. He didn't touch the question. $172,000. That's a lot of nights at $200 a night that this ministry paid out to his colleague, the member from Regina Northeast. It's a basic question that the minister should be able to answer. It's basic transparency for public dollars. Right. Something this tired and out-of-touch government has no interest in. The public accounts are supposed to list every person or vendor paid more than $50,000 in a fiscal year. The minister says $172,000 was paid, more than 3 times that threshold, Mr. Speaker. Why doesn't it show up in public accounts? What is the Sask Party hiding? Hear, hear.
Recognize the Minister of Social Services.
Speaker, not hiding anything. We've committed to getting the specific information, Mr. Speaker. In terms of how it's presented in public accounts, I can certainly look into that. They're, in a general sense, they're large general categories, Mr. Speaker, and so. But again, we've committed to look at those numbers, and it is a process to go through. And the member knows anytime there's a freedom of information or written questions, it does take time to get those numbers available. We've committed to do that. The work is underway, Mr. Speaker. So again, Mr. Speaker, the provincial auditor has indicated to officials that she is going to look into this matter as she does in her regular submissions, Mr. Speaker. So that work is underway, and that the member that member talked about on this side, Mr. Speaker. My understanding will meet with the Conflict of Interest Commissioner to look into this matter as well.
Right. Here. Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, the public accounts process is straightforward. This is highly suspect, and it's disappointing not to hear any answers from that minister. Mr. Speaker, they're failing on transparency. They're also failing on childcare. We're joined today by advocates for childcare in Saskatchewan. Later, we'll be joined again from the director of Wiggles and Giggles, who's no stranger to this place, who still can't staff her centre. This isn't just an education issue. It's a cost of living issue for families. It's an economic issue for women who want to get back into the workforce. It's essential to the future of our province. The deal the Sask Party signed with the Feds calls for 28,000 additional childcare spaces by the end of 2026. The clock is ticking, Mr. Speaker, and to date only 4,696 have been created, and only just over 2,000 of those spaces are actually operational. When will this government actually deliver the childcare spaces that people need? Hear, hear.
Recognize the Minister of Education.
Thank you, Mr. Speaker. Mr. Speaker, for the opposition to say that this is a government that doesn't care about childcare in this province is absolutely rubbish, Mr. Speaker. And, Mr. Speaker, this is a government that in this fiscal year is investing nearly $400 million in early learning and childcare operations around the province, Mr. Speaker. Just earlier this month, Mr. Speaker, I stood beside Glenn McCallum, President of the Métis Nation of Saskatchewan, to announce that we have invested $23 million to open up 2,300 new childcare spaces all across the province, Mr. Speaker. We have fantastic partners like the Métis Nation of Saskatchewan. I was at the YMCA facility down on South Albert Street yesterday. Again, we have some excellent partners in childcare as we continue to build the spaces and build the sector here in Saskatchewan. Thank you.
Recognize the member from Regina Alfred Centre.
There's no denying it. I mean, the photo ops, the headlines, they're great at that, Mr. Speaker, but the reality on the ground is anything but. 92% of kids in this province live in childcare deserts, and we'll be hearing from the author of that report later today. Only 7.5% of the spaces they've committed to are fully operational, Mr. Speaker. It means parents like Zinkel, like Sherry, a public health nurse, can't access $10 a day daycare. Sherry pays three times that for a part-time spot, and she has to ask herself whether she needs to leave the healthcare workforce to make this work, Mr. Speaker. It's not acceptable. Access to a wait list is not access to childcare. Will the minister guarantee today that these 28,000 spaces that were promised will actually be up and running? Because with the way things are going, it certainly doesn't look like it. Hear, hear.
Recognize Minister of Education.
Thank you, Mr. Speaker. Mr. Speaker, as I indicated, we have numerous excellent partners across the province as we work to expand childcare availability across the province, Mr. Speaker. You know, when it comes to staffing, Mr. Speaker, we've announced wage enhancements, Mr. Speaker. We have tuition-free education. Mr. Speaker, I'd love to answer the question, but the opposition continue to interrupt me at every opportunity, Mr. Speaker. Mr. Speaker, in contrast, Saskatchewan had the poorest record on childcare under the NDP, and that was by admission of their own finance minister at the time, Mr. Speaker, who admitted that their government didn't make any investments into childcare, Mr. Speaker. Contrast this with our government, Mr. Speaker, announcing new spaces. Often, Mr. Speaker, we're going to continue to make investments to grow the sector. Thank you.
Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. This tired and out-of-touch government isn't focused on the things that matter to people. They're not focused on health care. They're not focused on the cost of living. But they got a lot of time and a lot of money for the Premier's big trip to Dubai. Nearly $1 million for a pavilion in Dubai, while investments are badly needed in health care and education. The cost of that pavilion could pay for 300 mammograms instead of being wasted. How does the Minister of Trade and Export Development justify wasting these dollars in Dubai when they're needed in health care?
Recognize Minister of Trade and Export Development.
Well, Mr. Speaker, the NDP demonstrate day after day after day why they have no credibility on any economic questions, Mr. Speaker. We announced that we were going to talk about our sustainable industries, Mr. Speaker. We had initially 45 companies that signed up to come along, Mr. Speaker, with the government. Since the NDP have started talking about what a terrible waste this is, 13 more, Mr. Speaker, have signed up to come and tell their story about their sustainable energy production, their sustainable agriculture production, a story, Mr. Speaker, that they clearly don't want told, and a story, Mr. Speaker, that clearly Justin Trudeau, Stephen Guilbeault, Jagmeet Singh and those members opposite are doing all they can to prevent being told internationally. Mr. Speaker, we are not going to apologize for working with our companies, for working with our entrepreneurs and having that message told right around the world, including at COP28, Mr. Speaker.
Recognize the member from Regina Walsh Acres.
Mr. Speaker, that minister sat as an opposition member in Parliament from 2004 to 2006. He had a front row seat to see what happens when a tired and out-of-touch government believes it's entitled to its entitlements. He should know better than anyone about how bad that looks. This week, we learned that the Saskatchewan Research Council is sending a delegation to Dubai. SRC is, of course, owned by the taxpayers of Saskatchewan, and Saskatchewan people will be on the hook. How many other crowns and government agencies are going with the Premier's entourage, and how much is this going to cost Saskatchewan people?
Recognize Minister of Trade and Export Development.
Mr. Speaker, you better believe SRC is going to COP28 to talk about the incredible work that they are doing in sustainable energy production. We had an amazing announcement, Mr. Speaker, earlier this week. The government is working with SRC, working with Westinghouse Electric to produce the world's very, very first microreactor right here in Saskatchewan, Mr. Speaker. What you would expect to hear from the members opposite, Mr. Speaker, would be support, but we didn't, Mr. Speaker, because they opposed this, Mr. Speaker, in addition to any nuclear value-added, any uranium value-added. We are going to be going to COP28. SRC is going to be with Westinghouse, with Cameco, with other uranium companies, nuclear companies, Mr. Speaker, telling our story to the world because it's a great one to tell.
Recognize a member from Saskatchewan Rivers.
Thank you, Mr. Speaker. Last session, I brought up the growing issue of students being left behind in our education system, with an increasing number of students falling below the grade level requirements. Our provincial grade levels in math, science and reading are all below the national average. Again, 1/3 of Saskatchewan students in grade 3 are not meeting the minimum grade level requirements. In the Saskatchewan River School Division report of 2022, it found a shocking 50% of grade 3 students are below the reading grade level. Mr. Speaker, this issue is only getting worse, not better. It has measurable impacts on students' well-being and their future success. The government has had months to investigate this serious issue since I raised it last session. What are their findings, Mr. Speaker? Where have they been dropping the ball to let so many students fall through the cracks?
Recognize Minister of Education.
Mr. Speaker, the learning results and the competitiveness of our students is something that this government and our Ministry of Education takes quite seriously, Mr. Speaker. Mr. Speaker, we know that during the pandemic it was a challenging time for students, a challenging time for parents and teachers alike, Mr. Speaker. I'm proud to say that since the end of the pandemic, our grade 3 reading results have improved, Mr. Speaker. We continue to focus on that, Mr. Speaker. Mr. Speaker, I'd point the member opposite to the provincial education plan that we released several weeks ago, Mr. Speaker, endorsed by all 27 school divisions, Mr. Speaker. One of those priority areas, Mr. Speaker, is learning and assessment, Mr. Speaker, and that talks about our government's focus on improving results of students and ensuring that we have robust learning opportunities for children around the province wherever they go to school. Thank you.
Recognize a member from Saskatchewan Rivers.
Thank you, Mr. Speaker. I have two families here today that have experienced the failure of the public education system. Miss Jenna Blaschuk and her children, Miss Faith Davidson and her parents. They have both experienced the shortcomings of the education system's ability to help students reach their grade level requirements. Both families have found success outside of the public system, drastically improving grade scores and academic performance. Mr. Speaker, these options are costly, very costly, and force parents to pay out of pocket to help their children receive the basic education that they deserve. I have two questions for the Minister. When will this government put proper assessment tools in place to make sure parents can trust that their children are not left behind? And secondly, will the Minister meet with these two families to discuss their concerns about the public system and how it's failing their students and the families?
Recognize Minister of Education.
Thank you. Mr. Speaker, I'd be pleased to meet with the guests after a question period and discuss their concerns and their ideas on how to improve our education system, Mr. Speaker. To respond to the member opposite, as I outlined, in our provincial education plan, learning and assessment, one of our key priority areas, Mr. Speaker. I look forward to working with our school divisions and sector partners in the educational sector on assessment over the next several years, Mr. Speaker. We look forward to making sure that we have the right assessment tools in place to really ensure that our students are competitive in the global marketplace. Thank you, Mr. Speaker.
Recognize a member from Saskatchewan Rivers.
Thank you, Mr. Speaker. This week, Alberta Premier Danielle Smith invoked the Alberta Sovereignty Act, telling the Prime Minister no. His energy regulations are unconstitutional. In contrast, what did we see out of this Liberal government opposite? They decided to create a tribunal committee spanning multiple years to study the economic effects of Trudeau's energy regulations. They even plan to consult Ottawa on the matter. To quote, "Look at all the angles, Mr. Speaker." While Alberta takes action, this government is once again failing to stand up for Saskatchewan while spending hundreds of thousands of dollars to study the impacts of Trudeau's unconstitutional demands. Why can't the Premier take some direction from his counterpart in Alberta and just say no? Just say no to Ottawa.
Put your hand up if you're a Liberal.
I understand I didn't hear it, but you referred to the government as the Liberal government, so I just want to caution and make sure you identify the parties properly. Going to answer the question? Recognize the Premier.
Mr. Speaker, in the absence of a Liberal government in the province of Saskatchewan, I'll take that question. Mr. Speaker, most certainly I wish the member the very best of luck. It sounds to me like she might be running in the next school board election as opposed to the provincial election, Mr. Speaker. Mr. Speaker, I want to address a number of things that have risen over the course of the last week. We often talk about what the NDP government did a decade and a half ago. Just the last week, Mr. Speaker, we've seen in health care the discussion around unprecedented investment in this province, Mr. Speaker. The NDP opposition gets up and they say that's not enough, but yet they have no plan, Mr. Speaker. When it comes to supports for our communities most vulnerable, they get up, they say that's not enough, yet they have no plan, Mr. Speaker. It comes to childcare, a rare point where the government of Saskatchewan did work with the federal Liberal government, Mr. Speaker. Mr. Speaker, with unprecedented investment, NDP say that's not enough, yet they have no plan, Mr. Speaker. And then when the economic update comes around, they say, whoa, 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 that's too much. You need to cut back on supporting agriculture and farmers in this province. Rip up the GRIP contracts like they did years ago. That's the only advice we have seen from the opposition this week, Mr. Speaker, and they are going to be opposition for a very, very long time.
I recognize the Government House Leader.
Point of order, Mr. Speaker.
State your point of order.
Thank you very much, Mr. Speaker. During a question period, the member for Regina Elphinstone repeatedly referred under Rule 20(2), and I would cite your deeply considered and significant ruling that was very clear and definitive last Thursday, Mr. Speaker. Quote, "You're not to refer to another party's caucus, what they do at all." Member repeatedly referred to caucus matters. She needs to stand in her place, withdraw, and apologize.
Yep. Yes, she did. Recognize the opposition House Leader.
Mr. Speaker, I listened closely to the member's question. It was clearly about the spending of government funds. If anything, this is a debatable fact, and it should be the member opposite should know that. And, Mr. Speaker, I'd ask you to find that this point is not well taken.
Hear, hear.
Hear, hear.
Taken under advisement.